Welcome everyone to the webinar this afternoon on the National Early Warning Score. I'm just going to give everyone a couple of minutes just to enter the webinar. It's 12:59 now, so I'm just going to give them just a minute or two longer and then we'll get going. So thanks for all joining us today. Quite a few of you, that's nice to see. Some familiar faces. So just to make you aware that you will get a recording of this sent to you. So with the email that you registered with, we'll get a recording sent over to you after the webinar. It's probably going to be next week, so just keep your eye out on the email that you registered with. You'll get the recording of the webinar, so that's the slides. You'll also get the news pack that I've done for everybody, just on the news part, just really what to talk about today. You'll get that in a resource pack, and of course, you'll get your CPD as well. It's a CPD certified webinar today. Okay, it's 1 o'clock now, so I think we'll get going. What I would ask is, well, first of all, let's introduce ourselves. So I'm Lucy Caldwell. I'm the RGN at Carebeans, and so I host these webinars every month. As I say, there's a few familiar faces. Nice to see you all again. So I generally do these the last Tuesday and Thursday of every month. We look at different themes, we look at care planning and that kind of thing. And today we're looking at the National Early Warning Score. What I would ask if you could just mute yourselves, that would be great. So I'm just going to sort of put you all on mute. If you do have any questions throughout, feel free to pop it in the chat because I'll look at that periodically throughout. But we will have a Q&A at the end as well. Just if you've got any questions, then feel free to ask. So I'm going to switch my video off for this, but let me just check that I haven't muted myself. No, I haven't. Okay, so we'll get going. So thanks for joining today. As I say, you'll get a recording of the webinar. So that's the slides you'll get sent to you. You'll get a CPD certificate and you'll get a little resource book as well. Okay. So we're looking at the National Early Warning Score, so the news for short. That's what I'll be referring to it throughout as the news. So the news detects and responds to clinical deterioration for people within your service. And we're going to be covering today what the National Early Warning Score is, so what the news chart is, how it works. We're going to look at the physiological parameters. So each of the measurements that you need to take on somebody in order to get a new score. We're going to look at the scoring and the guidelines, and they're all in line with the Royal College of Physicians official guidance. And then we're going to go onto the system and I'm just going to show you where the news chart sits in the system, how to use it, how the guidelines pop up, where you can record what action taken, etc., and how to pull up reports as well. So that's what we're going to be covering over the next hour. We'll go through the slides, then we'll go onto the system. And then if you've got any questions, do ask. As I say, if you want to pop something in the chat throughout, feel free to do so. I'll keep having a look every now and again. Okay, so what is the National Early Warning Score? So it was developed by the Royal College of Physicians to improve the detection and response to clinical deterioration in adults. So in those that are 16 or above, and it's not to be used for women that are pregnant, but any other adults it can be used for, 16 and above. So it's a standardized tool that's used to assess and respond to acute illness. So it's a key element of service user safety and improve service user outcomes in the event of deteriorating health. It gives you sort of official guidance as to what to do. It was updated in 2017, December 2017. So you'll often hear as it being referred to as the News 2. That's a sort of second version. So it was originally produced in 2012, but it was updated in 2017, and we have the latest version on the system for you to use. So yeah, the latest one that was done in 2017. But let's look at how it works. So the news works it's a simple aggregate scoring system. So aggregate scoring means total score. So it's based on a simple aggregate scoring system in which a score is allocated to physiological measurements, which we'll look at shortly. And these are already recorded in routine practice. So it's the measurements that are often taken when you go to hospital. And yeah, it's an aggregate scoring system. That's how it works. It uses physiological measurements. So again, we'll look at those shortly. So it looks at measurement of different bodily functions. So we'll look at those in a sec. The news chart can be used in different settings. So it can be used in acute care. So in the hospital scenario, historically, that's where it's been used the most. In acute care, it can be used in primary care, mental health care, ambulance care, and care and community homes as well. So it's exactly the same scoring system for all of those different settings. But the guidelines are slightly different depending on what setting you're in. So that sort of differentiates it. So we've used the care and community homes version, and we've also added the guidelines for the mental health as well. So that's the version that we've got on our system that's designed for use in care and community residential settings. So it's been adapted to use in the community, and they're the guidelines that come up when you do your score. So let's take a look at the physiological parameters and what I mean by those. So the physiological parameters, they form the basis of the scoring system. There's 6 parameters, that is respiration rate. We're going to look at each one separately now. But respiration rate, oxygen saturation, blood pressure, I'll explain what systolic blood pressure is, pulse rate, level of consciousness or new confusion in somebody, and temperature. Okay, so they're the 6 parameters that we look at. So let's take a look at each one individually. So respiration rate means the number of breaths per minute. So we want to measure how many breaths someone takes per minute. So it's usually at rest. The best time to do it is when that person is at rest, not after they've done any sort of physical exercise. It's best to do it when at rest, and it can be measured by counting how many times the chest rises in 1 minute. So the normal respiration rate is 12 to 20 breaths per minute. And again, that's at rest. So anything below that, so anything below 12 or anything above 25 breaths per minute whilst resting could be a sign of an underlying health condition. So that's the respiration rate. If we now look at the oxygen saturation level, so this of course is taken with an oxygen saturation probe. Oxygen saturation is the blood oxygen level. So the amount of oxygen saturated at what we call hemoglobin in the blood. So hemoglobin carries oxygen around the body, and this is the measurement that you get the oxygen saturation. So the normal oxygen saturation is around 96 to 100%. Anything below 96% again could be a sign of an underlying health condition. Now, I just want to look as well at oxygen saturation for those with something called confirmed hypercapnic respiratory failure, so HRF as it's known. So HRF is too much carbon dioxide in the blood. So if your body can't get rid of carbon dioxide, which is a waste product, then there isn't enough room for the blood cells to carry enough oxygen. And HRF can often be found in people with certain respiratory diseases, one of those being chronic obstructive pulmonary disease, so COPD as we sometimes call it. And there, people with COPD or certain respiratory diseases with HRF, their oxygen saturations are likely to be lower. So on the system, and I'll explain this properly when we go in, it'll be a bit clearer, there's 2 scales. Everyone will get defaulted to scale 1. So scale 1 is a certain score for those without HRF. But if people do have HRF, then scale 2 can be used. Now that must only be used, let me just try and get rid of this little bar here. I'm not sure if you can see this actually. So that scale 2 should only be used if confirmed by a clinical decision maker. Okay, so it needs to be used if confirmed by a clinical decision maker because it adjusts the scoring in line with expected saturations because their saturations are likely to be lower. So it needs to be a competent clinical decision maker that makes that decision, that's instructed for scale 2 to be used, and that should be recorded in the service user's care plan if that's the case. And it's just a simple switch. I'll show you when we get onto the system. But otherwise, for everybody else, the default scale that it goes to is scale 1. This will make more sense, I think, when we get onto the system and just have a look at it. So the next parameter is blood pressure or systolic blood pressure. So As we know, when we take a blood pressure, you've got these sort of two values, your sort of top value, bottom value. So say my blood pressure was 125 over 75, for example. That top value is the systolic blood pressure, and the bottom value is the diastolic blood pressure. So the systolic blood pressure is the one that's taken into account when the news does the scoring. And the systolic blood pressure is the pressure when your heart pushes blood out around your body. The diastolic being when your heart's resting in between beats. So the systolic one, the top one, is the value that gets taken into consideration. You put both in, you put 125 over 75 in, but the news chart will take consideration of the systolic blood pressure, the top one. So a normal blood pressure is considered to be between 90 over 60 and 120 over 80. And again, outside of this range could be a sign of an underlying health condition. The pulse rate. So the pulse rate is how many times the heart beats per minute. That's often also called the heart rate. So the heart rate, the pulse rate, it's the same thing. A normal pulse rate is 60 to 100 beats per minute. So that's the normal resting heart rate for adults. And again, anything outside of this range could be a sign of an underlying health condition. And of course, everyone should be trained to do these measurements in people, do these physiological parameters. And just a tip when you are doing the pulse rate. So obviously you would gain consent before you're doing any of these measurements. You would explain to the person what it is you're doing. It's quite a good tip when you're doing the measurement of the pulse, just to say to them that you're just going to be measuring their pulse over the next 2 minutes. And if you measure their pulse for the first minute and then do their respiration rate for the second minute, because if people know that they're getting their respiration rate checked, sometimes that's the one thing we can control. So sometimes people, without realizing, subconsciously, they sort of might breathe slightly differently if they know they're being watched. So it's quite a useful thing to say you're monitoring their pulse for 2 minutes, do that for 1 minute, and then do the rest rate for the second minute. Just a little tip there. And you can always tell them afterwards that you did their respiration rate as well, so they're fully informed. So the next parameter is level of consciousness or new confusion. So we're looking at both of these things. So we're looking at consciousness, so how alert someone is. So the definition of consciousness is being aware of and responsive to one's surroundings. So when we're looking at the news chart, we're looking at whether someone's alert, so whether they're like you and me, awake, chatting, talking to people, whether they are drowsy, maybe only responsive to sort of verbal prompts, maybe only responsive to pain prompts, or maybe unresponsive. So that's what we're looking at when we're looking at the consciousness level. When we look at confusion, the sort of definition of that is not being able to think or speak clearly or quickly. It also might display as not knowing where they are, so being disorientated. They might struggle to pay attention or remember things, or they might see or hear things that aren't there. So when we're looking at whether someone's confused, what we're thinking about is new onset confusion. Because of course, if we're doing a set of observations on somebody and we're looking at confusion, and somebody has got dementia, for example, and so we would expect them to show signs of confusion. If that confusion has worsened, then that's when you would say that they were confused. So it's either if it's new onset confusion, they've never normally been confused, but they are now, or it's if they are normally confused, but it's worsened. And if in doubt, because it can sometimes be quite difficult to tell with someone with dementia whether their confusion is worsening. So if you're in doubt, mark them down as confused, as in it's worsening. Okay, so I hope that makes sense. We'll look at those scores shortly. Let's just see if we've got any questions so far. No, okay, that's fine. Okay. And then finally, temperature. So temperature is the core temperature of the body. So the normal temperature is around 36 to 38. Of course, that would be taken with a thermometer. A high temperature is usually considered to be 38 or above, often known as a fever. And anything outside of these ranges, as we've said before, could be a sign of an underlying health condition. So if we go on to the next slide, as I said before, when you're measuring these physiological parameters, you and your staff do need to be trained on how to take the measurements correctly. Okay. So there's a range of resources that are out there. The Nursing and Midwifery Council and those nurses out there, those of us that are nurses out there, will have been trained. If we're trained in the UK, we will have been trained to use the Royal Marsden Manual of Clinical Procedures when we take our observations. So that is a good reference tool if you want to refresh yourself on how to take observations correctly. That's a good sort of resource to use. And also there is this, there's an OCB Media. I've put the link here and you'll get these slides sent out to you. But this also has really good resources for the news tool and how to take observations, the physiological parameter measurements. This is the sort of official resource that we would use in line with the Royal College of Physicians recommendation. Okay, so as I say, you'll get that link sent to you, get all this sent to you so that you've got, copies of where you can go to refresh your training or receive new training. I think on this site, if you've got an NHS email, I think it's free to get those resources. And I think if you haven't, well, the last time I looked, it was £5 per person, I think, to get access to those resources. But they're really good. I've done my refresher training on that particular site. So that's OCB Media. Okay, so now we're going to look at the scoring. So a score is received for each parameter that's measured. Okay, so it's allocated to each parameter as it's measured. So the magnitude of the score reflects how extremely the parameter varies from the norm. Okay, so if it's within the norm, it's a 0. Slightly above, it could range between 1 and 2. If it's quite out of that range, it would be a 3. Okay, we'll look at that a bit more shortly. So the score is aggregated, so that means it's totaled. So we would take each measurement and we would get a score for each. It will work it out for you, so you don't need to worry about working that out. It will work it out for you. And then at the end, when you save, you get the aggregated score. So that's the total score. And that's the score that's uplifted by 2 points if someone has, like, for example, supplemental oxygen to maintain their oxygen sats as well. It's slightly tweaked. But that's what the aggregate score means. It's the total score at the end. And that score dictates what guidelines you were given. And those guidelines are, as we said before, Royal College of Physicians guidelines, the official guidelines. So the key emphasis for the news chart is system-wide standardisation of measurement and recording. So it's a pragmatic approach. The key emphasis is on system-wide standardisation and the use of these physiological parameters that are already routinely measured in sort of nursing practice in hospitals, etc. So in other words, the news chart, as we said, is the same scoring, whatever setting you're in. It's just that the guidelines are slightly tweaked dependent on the setting that you're in. So what I'm going to do now is I'm just going to take you through how we use it on the system. So I'll sort of go through where we can record and what we can record, but then I'll go on to the system just to consolidate all that. So baseline observations. We have an area on the system in the alerts page, I'll show it to you when we go on it, to record baseline observations. So baseline observations is a set of those parameters that we've talked about when that person is well, okay? So that's often what we do on admission. If we take those people's parameters, that's often what we do on admission, a set of baseline observations. It's important that we record those because they can be used to compare to current news scores as well. And it actually does come up when you get your news score. The baseline obs come up as well so that you can compare them. So often that is, as I say, done on admission, but it can be done at any time when that person is well, a set of baseline observations. So the point of that as well is it's good to be able to compare those because, like, for example, I have a low blood pressure and I'm sure if I had my news score taken, it would score me a 1 for my blood pressure, but that wouldn't necessarily be outside of the norm for me. So it's important just to know what the baseline obs are so that you can compare and to sort of form part of your management plan. Okay, and I'll show you where that is on the system. So you put a news chart in place. You can put a news chart in place for anybody, or a number of service users, for every service user. It's up to you, and whether that person requires one. If they do, you can put one in place. So you can create an action, and you can attach a news chart, or you could just do it as an observation. Switch on the observations section. I'll show you that when we go onto the system. If you just did it as an observation, you can sort of dip in and out as and when you need to, but it's better to create an action, and I have done one for a sample person. It's better to create an action because then you can put frequencies in place. So it might be as part of your management plan for that particular person that you do a set of observations on them once a day, for example. Write that in the plan for them. And you can set the news chart to be done once a day. But the key thing with the news chart is if you're worried about someone's deteriorating health, you can just go straight in and do one there and then. Okay, that will give you guidelines. We'll look at those shortly. It might tell you to increase the observations to, for example, 4 hourly, and then you can go back into your action and you can change that to be done 4 hourly. So it reminds everyone to do it every 4 hours. So you record each of your 6 physiological parameters. You can record any notes with that, and then you save the score and the guidelines will come up. We've also got reports on the system. So News is a track and trigger tool. Actually, I've just gone. I might have missed a little slide there. There we go. So follow-up action. So when you use it on the system, if you are concerned about somebody, and obviously if you get a score, and it will tell you what to do, to tell a senior to review it. There we go. Okay. So obviously it's designed, if you're worried about someone's deteriorating health and you do a news score on them, it will tell you in the guidelines to sort of report to somebody else if needs be. But if in doubt, just always tell somebody. Always tell somebody. Obviously on the system, you can do your news chart. It will go to your operations dashboard, so people will be alerted. But it's always good practice as well to verbally tell somebody. Okay, just so that people are aware you've done a news chart on that person. The score might be higher than expected. And there's also access on the main care plans, on the main care plan page to that news chart as well. And I'm going to show you all of these places now. And important to remember that if the score is 5 or above, and it will tell you this, but I just want to reiterate it here, that if the score is 5 or above, you should always think sepsis. Okay, so always think sepsis. But the beauty of the news chart is that if you do have a high score on someone and it's telling you to contact emergency services or whomever, then you've got your score. Everyone knows what that means and understands the sort of gravity of the situation. So if I just go to my next slide. Okay, so that's it, reports. So News is a track and trigger tool. So it tracks scores and triggers actions. So should someone's health deteriorate? And you can find reports in the observations section. And again, I'm going to show you that now. So if you did want to have a look at previous the previous news scores, you can do by going into your reports and very easily looking at all the previous news scores, seeing what they were, what the total score was, and also the individual score for each parameter as well. So action needs to be taken in line with news guidance. There should be a management plan in place or a care plan in place, just saying what someone's normal measurements should be. If you do take someone's parameters as a sort of standard thing, like every day or every week or whatever, you should have that in their care plan. But then of course you can always use your news if you're worried that someone's health is deteriorating. Now, there might be certain circumstances where the news guidance will suggest contacting transferring that person into hospital. Now, that might not always be appropriate for certain people. So, for example, those at the end of life who've chosen not to go into hospital, their score might be high. The guidelines might be suggesting that you transfer them to hospital, but it will say if appropriate. And if it's inappropriate to send that person to hospital, that's a discussion that should have been had with the medical team, and that should be recorded in their care plan. So it just all needs to be recorded so that everyone knows where they're at. And as I said before, if you're concerned about a service user, as well as doing a news chart, tell someone immediately. Okay, so let's go into the news chart and just have a look. I'm just going to grab my list so that I can do this in a nice logical order for you. Okay, so let's got nothing on the chat yet, so that's fine. As I say, we'll do a little Q&A at the end. Okay. Actually, I'm just going to let you know as well. Just sign out again. I'm just going to let you know as well. Many of you might know that we've sort of merged with QCS, so they've got policies and procedures on their systems, on their compliance centre, and it's just worth knowing that they have policies on all those different parameters and how to take those measurements correctly, and they're all in line with the Royal Clinical Guidelines for the Royal Marsden. So if you did want to learn more, you can actually click on that on your login page now, and you can sort of learn a bit more about that and get a trial of those if you wanted to. So just to be aware that they're there on that system because they're really useful. And again, I've used those as well to do my refresher training on how to take observations correctly. So let me just go into the system now. Okay. So first of all, let's go into our chap that we've chosen for today. So it's James Adams that I've put in place, news charts and things. So the first thing I said, if we just go back, if we think back to a few slides, it was doing those baseline observations. So a set of observations when he's well. So he's been admitted to the service. We've done a set of observations on him. I just want to record those somewhere. So if you go into their care plan page and then go into the alert section, scroll all the way down, and you'll see usual parameters. So these parameters should be implemented by a community matron or an advanced nurse practitioner or GP, or those qualified to do so, okay? So it might be, we've got the chance to put a range in here. So from whatever to whatever. But if you're just doing a set of baseline obs, you just need to put that one set of baseline obs in there. If a doctor or an advanced nurse practitioner or someone else has suggested a range, that's a normal parameter for them, then you can put that in. But if it's just you doing a set of observations on that person, then you can just put one set in. It won't make you do this range. You can just put them in on this side. And you can see down here, everyone's defaulted to scale 1, as I was talking about before. We've got a little information button there. So if you hover over it, it will tell you what that means. And then scale 2, this is the scale that should be used if only if decided by a competent clinical decision maker, and that needs to be recorded in their document. So that's for someone with hypercapnic respiratory failure, where their oxygen saturation targets are expected to be lower than normal. Okay, so that's when you would click scale 2, and it would adjust the scores accordingly in line with that. Scale 1 is what it's defaulted to. Okay, save that information, and then they sit there as your baseline observations. So what we'll do now, I'm going to show you what I've done for this man in terms of putting a news chart in place. So if we go into his actions, I've done it two ways actually. I've just put in a simple observation chart. So yes to a news chart. That's popped a news chart in there. But I can't, if I do it this way, I can't sort of time it or anything. I can't put any person-centered instructions in there either. So what I would recommend is that you do an action. So I've done an action here. I've called it a news chart. I've perhaps recorded in the physical health care plan how often I want to do these observations as standard, my routine observations, and then more frequently if I feel that their health is deteriorating. So what I've done is I've created a news chart action. I've linked this into a physical health care plan, and I've added the news observation chart here. Okay, you can put some person-centered instructions in here as well. So that might be things like, make sure you've gained consent before you're about to do the observations or do the measurements, explain what it is you're doing, etc. So you can put person-centered instructions in there. But the key thing with doing it as an action rather than that observation that I showed you, is that you can time it if you wanted to. So, for example, I've put that he has them done every day. Every day before 11 o'clock, we do a new set of observations on him. But I will also do them if I feel his health is deteriorating as well. I'll just jump straight in there and do a set of observations. What I've also done here is I want him to get the news chart done every day before 11 o'clock. And if that's not done by 11 o'clock, I just want an alert to the operations dashboard. So that's just something to bear in mind for those that weren't quite sure about this frequency. You can sort of do, a couple of different things there in terms of alerting. This will, I'll come back to this in a minute when we give someone some observations that are slightly out of the parameters. So I'd save that, and this is what it would look like. So we'll use the support worker dashboard, but of course those that use the app as well, this would appear on the app in the actions section. Switch on an observation, it would be in the observation section. So let's just go into Gym now. Okay, so this is what they look like. So that's the observation that I switched on. Takes me through to the news chart. And then, oops, let's go back there. And then this is the action, okay? So it doesn't matter whether I do it this way or this way, it will actually, it's best to do one or the other, but if I did it this way, it would still talk to the same document, in other words, but it's best to just do one or the other. I would suggest doing one on an action here. Even if you didn't put a frequency on it, just pop it on an action here, just so that people are aware it's there, should they need to do one in the event of deteriorating health. So you can see I did mine 10 to 12 today was the last time I did it, and it's due again tomorrow. But if his health is deteriorating at any point, I will just hop in and do one immediately. Okay, so let's just have a look at it and see what it looks like. So if we click into it, okay, this is what it looks like. So you've got all your different fields to add your different measurements. You've got a notes section at the bottom as well. And when I save it, it's going to give me a score down here. So let's say, for example, he's got a rest rate of 13 rests per minute. His oxygen's 99. We'll give him some sort of normal obs, and then we'll give him some less normal obs. So let's say his score is oxygen saturation is 99%. It will ask you if it's on room air. So if they're not on an oxygen mask, if they're just breathing in room air like me and you, it will ask whether they're on air or whether they are on supplemental oxygen. So it's important to put which one they're on. So I'm going to stick to room air here. I'm going to put that his blood pressure is 120/75. His beats per minute. You've got your little icons here just to tell you what's what as well. Your beats per minute will say 67. This is what I meant. You can only pick one of these, and this is what I meant about that confusion and consciousness. So we're looking at whether they are alert, whether they've got new confusion or worsening confusion, whether they're only responding to voice, so they're dozy and sleepy, only responding to voice, whether they're only responding to pain, or whether they're unresponsive. Obviously, if they're unresponsive, you need to, check their breathing and all that, and and go through that process that you normally would. But if they're unrousable, so you can only pick one. So it might be, let's say we're going to say that he's alert, and we're going to say that his temperature is 36.8. Okay, I'll click anywhere. That's going to say that there's no alert, and we're to continue with routine news monitoring. Okay, so I would save that, and that would get popped in his records that we're to continue routine monitoring. Okay, let's do another set now where things are worsening, let's say. So his health is deteriorating, and we want to do a set of observations on him. I'm sort of labouring my talking now because I don't want to do it too quickly afterwards. Sometimes if it's a few seconds, it won't let me. So let's just go on to it now. Okay. So let's say now, do you remember me saying that it gets a score between 0 and 3 for each observation, for each parameter? So if it's score 0, it's within normal range. If it's 1 to 2, it's slightly out. And if it's 3, that's quite out. And that's really significant. That's what we would say 3 in one parameter. It's a very significant score. This will turn orange, just to sort of make it visually clear that there's a high score in that area. So let's say his rest rate is 28. Okay. So I go on to my next one now. That's immediately gone orange. So that's telling me that there's a score of 3 in one parameter. So that's just, even if everything else was normal, I'd be quite concerned about this. So let's have a look at his oxygen. Let's say it's 92%. He's on room air. Let's say, so that's got a score. It's not yet orange, but it's got a score there because it has slightly changed. Let's say, but when you save, the aggregate score is what we are, is going to give us those guidelines. So let's say his blood pressure is 100/72. His beats per minute is 150. He's got some new confusion. He's got dementia, let's say. So he is normally confused. I'm trying to work out, is he worse than normal? I think he might be. I'm not entirely sure because he is normally confused. So I'm going to err on the side of caution and say that I do feel this confusion is worsening because I don't quite know fully. So I'm going to say that he has got new confusion. And then let's put his temperature. We'll give him a normal temperature. Okay. So I'm going to save that. So you'll see now, I'll write any notes in here as well that we might need to. And we can see here that he's scored 13, and this is an emergency response threshold. So this is the official Royal College of Physicians guidance, okay? So it's given me a set of things I need to do: immediately repeat observations, inform a nominated nurse or appropriate person within your service. You might need to do a GP or nurse review. You need to determine a management plan, what you're going to do about it, and an urgent hospital transfer if appropriate. So it might be that this person is at end of life and we've put in their care plans that it's not appropriate. We'd still want to take the appropriate action if they're poorly. It might be that hospital transfer might not be appropriate, but that needs to be put in the care plan. So it's giving me guidelines. I can also click this, hover over this information button, and that will elaborate more on what those guidelines mean. So that will give me a list of things that I need to sort of do and consider. Okay, so I'm going to save that. I'm going to go and verbally tell somebody and take the appropriate action. Okay, it might be that I'm the senior nurse on duty and I've taken these, so then I'm going to take the appropriate action. But contact a senior person just to make them aware of that news score so that appropriate action can be taken. Okay. What the next level of action is this will get taken through to the operations dashboard. Okay. Now, this is what's important to verbally alert. This doesn't have a sort of a beeping system or anything like that, but it will have been put on to the observations dashboard. It is in red. The score is 13, and we can view it and have a look, see what's been going on. Okay, so we can have a look. This is now flashing to say it's an emergency. So we can access that by the operations dashboard, or we can access this via his care plan page on this obs section as well. Just another place that we can access it. I'll look at his news chart here. Go down here, and this is his latest one. His score's 13. So what I would then do, I would go into this, and what I'm getting here now is the latest score, the clinical guidelines as dictated by the Royal College of Physicians, and I've also got his usual parameters. Okay, so we can compare. But we can see here that he's got quite a few that are orange as well. And can you see here, it just says if the observation is amber, the score is 3 in one parameter, so that's serious. So we can take the following action. We can say contacted 999. And whatever it might be that you've done there, whatever action you've taken, and save that. Okay. Now, let's say, for example, we do a score and the guidelines might come up saying do 4 hourly observations, for example. If the score was lower than what it was just then, it might say do 4 hourly observations. So what I would do then, I'd go into Jim's actions page, because at the moment this is set to be done every day. And I don't really want the carers to sort of try and remember to do that in 4 hours. So I'm actually going to change this. I'm going to go in and I'm going to say, that's now 4 hours that it should be done, or whatever the guidelines tell you. 4 hourly. There we go. And I've popped that in place there. Okay, so that is now going to prompt the carers to do it again in 4 hours or every 4 hours. And it's going to, there you go, it's telling me to do it again at 5:30. And then it will keep calculating 4 hours thereafter. Okay, so it's going to flash if not done. I've also set that so that if it's still not done after a certain time, to go to the operations dashboard as well. Okay, and if that's still not done on the operations dashboard, that does come up as a latest alert. Can you see it's come up here as well, that we've got the most recent one there. So now if we look, let me see if we've got any chat questions. No, so now if we look at the reports, I'm going to show you what we can see. So we've done our news scores, we've put a news chart in place, we've done one, we've taken the appropriate action as per the guidelines from the Royal College of Physicians. And I can also go into my observation report here for James. I could look at all services if I wanted to just look at all of the news scores for today, for example, but let's just concentrate on James still. I'll go to the bottom here, I've got the news chart. So this is actually the last month. I might just want to have a look over the last 5 days. Let's say from Sunday up to today. Oops. Try that. And then scroll down. There you go. Can you see this graph here? So I've got who it is. I've got his date of birth. So I've got his key identifiers, this picture there. I've got the graph, dates and times of when the most recent news scores were taken, what those scores were, what the total scores were. You can see our latest one there, which was 13, which we know about. And then you can also have a look underneath. So not only has it got the graph, it's also got the dates and the times here. The person that did the initial news score, what the score was, any notes that they put, and then the individual scores for each. As well as the aggregate score here, we've got the individual scores for each. We've got the second person that reviewed that, that was me as well. We've got the notes that they put in place. So what we can do, we can print that off. We could save it to a PDF if we wanted to, or we could print it off as needed, or we can just use this to refer to when we perhaps need to get this sort of information off. So I hope that makes sense. That is essentially the news chart and how to use it. If there's any questions, feel free to ask. Pop it in the chats. Do feel free. As I say, you're going to get this recording sent over to you next, or the link sent over to you. It's going to be next week now. That will be sent over to you. You'll get a recording of this. You'll get the slides. You'll get the CPD certificate, and you'll get a resource book. So that's basically everything that I've talked about today. All those slides, I've kind of done it into a sort of a nice, easy read format resource booklet that you can use as well. What I will say is that if you do want to start using the news tool and you would like a 20-minute session with myself, feel free to contact me. So it's lucy@carebeans.co.uk. Feel free to contact me. I'm more than happy to do that. I would like to do that. I want to make sure that you all feel confident and comfortable using it. And I'm more than happy to do a sort of 20-30 minute session on that. So it will cover sort of similar to what we've covered today, but I'll just sort of hone in more on that sort of last section of how to fill it in properly. Just give you a little training session on that. So I'm more than happy to do that if anyone wants it. Just let me know. Oh, Terry. Oh, hi, Terry. Thanks, Lucy. Very useful indeed for me, particularly on the e-care from my perspective. Oh, good. I'm glad that's helped. Yeah, hopefully that's sort of given you an idea of not only sort of how to implement it, but where you can find your reports and things as well. Yeah, I'm glad you found that useful. Good to hear. So I'll sort of hang around for a bit longer, see if there's any more questions. We've finished a bit earlier than normal, actually, about 15 minutes earlier, but you'll still get your CPD certificate, that's fine. Very happy to have attended. David, very happy that you were here. So if the patient is sleepy and only opening her eye while calling her name, so the conscious level, how do I respond? So if it's if right, so Daniel's asking if the patient is sleepy and only opening her eyes whilst I'm calling her name, what would the conscious level be really? So it would be voice. She's only really responding to voice. So it's only really when you're calling her name. Otherwise, she's very sleepy and drowsy, and she's only really opening her eyes when you say her name or a verbal prompt of some sort. That would be V. Yeah. Joe, it's been a very useful session. Glad you think so, Joe. Thanks a lot for joining. I'm glad you found it useful. Very useful. Great. Oh, good. No worries at all, Daniel. That's fine. Daniel said thank you. Brilliant. Okay, so it looks like we don't have any more news specific questions, which is fine. That hopefully makes me feel that I've explained it well. Hope so. But as I say, if you want to contact me, lucy@carebeans.co.uk, do feel free. If you want to start implementing it, it's a really good tool. It really gives carers and staff the confidence when they are contacting emergency services or the GP or whomever it might be. It really gives people that sort of backing and confidence to yeah, Sarah's saying she feels more confident with it now. I'm glad because it just gives people that confidence to give that sort of standardized score, that aggregate score that everyone understands. 'Cause I think historically people might feel like they're being a bit fobbed off if they're calling, medical teams or whomever to say that the patient or their service user is poorly. So it just gives you that confidence. So I'm glad. Okay, so thanks a lot for joining, everyone. As I say, wait for your email next week, which will give you details of how to access your CPD certificates, etc. Thanks a lot for joining. Keep your eye out on our website, www.carebeans.co.uk, for upcoming webinars. We've got a urine incontinence one end of March and a bowel incontinence one end of April. So do feel free to join those. If you are interested in looking at those QCS policies as well in terms of measuring those physiological parameters, then you've got that on your login page now, but you can always contact me and I can give you more information about those. Okay, so I will stop sharing. I'm going to just pop my camera on to say goodbye. Lovely. Can you see me? Yes, you can. Now, I couldn't see myself earlier. I wasn't sure whether I was on. Lovely. Okay, well, thanks ever such a lot for joining, everyone. It was nice to see you all, and I'll see you all next month. Goodbye.